is Meghann Miller, and we're going to be talking about the Work Incentive Planning and Assisted Program. By the way, Mrs. Dasher and Mrs. Miller are ADMH Community Work Incentive Coordinators. At this time, I'd like to hand it over. Mrs. Dasher, if you would introduce yourself.
My name is MaryJane Dasher, and I am the WIPA Project Director.
And Mrs. Miller, if you would introduce yourself.
Hi, I'm Meghann Miller, and I'm a Community Work Incentive Coordinator.
Thank you both for being with us here this morning. And for anybody that's just tuning in, what exactly is WIPA?
So basically, it's an organization that receives grants from Social Security to provide individuals that are receiving disability benefits access to work incentive planning and assistance.
Okay, so to put this kind of in layman's terms, this would be somebody that is maybe working or trying to get employment, but is also receiving Social Security benefits, insurance benefits, and they are a little bit nervous that if they start working, that some of those benefits might be taken away from them. Am I correct in saying that?
Yes.
Okay, perfect. And what's a little bit of history behind WIPA? When has it been enacted here in Alabama, and some of the legislation?
Well, we've been before the actual WIPA grant came out, there were another grant. It was called BPAO for benefits planning. So it's been around for a while. I don't know the exact number of years. I think the first year that I actually started was the first year of the WIPA. So I think that was around, let me think just for a second. It was around, my daughter, 4, 7, I think it was in 2008.
Okay.
Was maybe the first.
I'm sorry, I cut you off there.
No, it's fine. Go ahead.
I know there's been a big push through the Home and Community-Based Services for employment. I think it's a really big thing for everybody to have equal access to employment. And it's a big part of who we are and how we give back to society. So as that employment push is coming, we have to make these individuals that are seeking gainful employment have tools and knowledge that. So you mentioned some Social Security work incentives. What does that mean to anybody that's unfamiliar with that?
Well, there are two different disability programs that we have. One is SSDI, and that's where someone has worked, paid into the system, and reached insured status. And then we have SSI, which is needs-based, low income and low resources. Now, both of these have some work incentives that they share in common, but each of them also have their own particular work incentives that they deal with. For instance, with Social Security and both with SSI and with SSDI, we have impairment-related workers, and that is something that can allow you to work more, yet there's less impact on your SSI. With SSDI, there are work incentives that allow you to test your ability to work or to continue working. You can get your full benefits during the first 12 months of the work activity. You can continue to get your cash benefits beyond the 12 months if your countable earnings are below something that we call substantial gainful activity. Each person is different, which is why we advise people just go ahead, even if they go through the WIPA program, to self-refer so that we can work with them, because not every work incentive is going to apply to every single person that we deal with.
Yeah, and it seems like it can be a little bit complicated for individuals that aren't familiar with the incentives and what WIPA does. And one thing that I really enjoy just from learning more about WIPA and everything that you do is you guys meet one-on-one with individuals. I'm kind of jumping around here in the talking points. But for anyone that's like, well, that's great, I'm learning these new things, but as you mentioned, each person is different, and these incentives will be different for each individual. And you don't have to be scared by that information, because you can call and make an appointment to have a meeting, sit down with an incentive coordinator and walk through these on an individual basis. Now, you mentioned,
Right.
Go ahead, I'm sorry.
Oh, I'm sorry. I was just going to jump in and say that it's very individualized, the services that we provide. So anyone that we get, we actually, get you to sign a release form. We're able to verify the type of benefits that you're receiving so that we are sure that we're giving you the correct information on the work incentives that are available to you. Okay. So basically, that's what our benefits planning does, is that we help the individual understand their benefits and do the individualized counseling, and how earnings will affect the specific benefits that the individual receives. And we don't just only go over, the Social Security disability benefits that they're receiving, but if you receive any kind of, housing assistance or food stamps, veterans benefits, and things like that, we can also help you understand how the effects of earnings on your benefits. But of course, we would have to verify everything before we give out that information.
Yeah, I imagine some of the time that it takes is from individuals and families compiling that documentation, getting all of the paperwork that you guys need in writing from whether that's ADMH or SSI, work,
Well,
those
we
kinds of things.
actually will get that for them. If they sign the release form, we are able to get that from Social Security. So it's nothing. It's just simply just that they need to, you know, sign the release form. Then we request the verification, and we get that. So that there's no real work for them on that part of it. Now, if you're getting food stamps or something like that, you can just usually there's a way that you can verify it online, or some other way that's not it's not too terribly cumbersome thing to have to
Mhm.
do.
Now, what is the
And usually
overall?
our I'm sorry. Usually our turnaround time once we receive the releases is within 2 to 3 days, and we're able to reach out to the consumer fairly quickly.
So you guys have a 2 to 3 day turnaround, and I know for some families that I've spoken with, they're used to a 6 month turnaround. So
Oh
that's a
wow.
really big thing. In a lot of, and not necessarily with WIPA, but when dealing with Medicaid or changes in service plans, those kinds of things, it takes a couple more months on average, is what I've heard. But you're saying it's kind of a plug and play. Call us, get a meeting, sign this waiver. We'll do this work for you, this background work on getting all of this documentation. We'll come back to the meeting and kind of lay out an individualized plan for you to see how the work that you want to get and how that's going to interact with your benefits. I,
Yeah.
and what are some of the biggest fears there? Because you mentioned that there are these programs that will allow you to work for 12 months without
Mhm.
affecting any of your benefits or any of your Social Security. I imagine some of the fears that these individuals and families have is, what if I go to work, I lose all my benefits, and then something happens and I'm no longer able to work? And there's a delay in that system.
Well, there are work incentives that one of them is called the extended period of eligibility, and that occurs immediately after the cash benefit stops for someone on SSDI. And that acts, I'm sorry, I said that wrong. But anyway, with the extended period of eligibility, it lasts for 36 consecutive months. And if someone's cash benefit ends, and shortly thereafter, in that 36-month period, they realize they can't continue to work at the same level, it's very easy. They can simply contact Social Security, let them know they're no longer working above that substantial gainful activity level, and then they get their cash benefit back. If that extended period of eligibility has ended, there's another work incentive that follows that can last for another 5 years, called expedited reinstatement. So if people need those benefits, Social Security is going to make sure that they have the ability to get back on those benefits without reapplying if they're needed. With SSI, it's completely different. With Meghann SSI,
Oh, yeah, sure. So with SSI, and it is important, I know we're kind of jumping around, going in between both, but it is important to know that, when we say, the extended period of eligibility and all of that, it only applies for individuals that are receiving SSDI. Okay. So SSI is a little
Gotcha.
bit different because it is needs based, which means it's based on your income. So any income that you receive in the month is going to affect how much your SSI payment will be. Now, Social Security does not count all of your income when you go to work. There are several work incentives that reduce that countable income. So basically, you can work and still receive an SSI payment. Or you could work enough to where it causes your SSI payment to completely go to zero, but you're always going to come out financially ahead in the SSI program by working. Okay. And with the SSI comes Medicaid, and that's one of the, main question too, that people, their fears that, their medical coverage will end if they're not eligible for a check. But that's not the case for either program. So your Medicaid can continue as long as your annual earnings are below a certain threshold that they have. So that can continue even if your payment is zeroed out in SSI. With your SSDI, that Medicare can continue for at least 93 months, which is like almost 8 years. If your earnings are above that SGA level, like MaryJane mentioned, if you're below that SGA, you're going to continue to get your check beyond that 12 months and your Medicare is going to continue. So really it's just, depends on the type of benefits that you're receiving. But we will be sure that once we work with an individual, that we know which benefit they're getting so that we, give them all of the information on the work incentives that apply to them.
It sounds like
And we were
SSDI
talking
has.
about those. I'm sorry, when we were talking about those 12 months, the very first 9 months of the trial work period, and they don't have to be consecutive. So it's not going to be, 9 consecutive months and then that's over. There's a number attached to it, and this year that's 970. So they'd have to earn over 970 before they even use the trial work period months. They just have to all be within the same 5-year period.
Hmm. So just to reiterate, you can make $970 if you're on SSDI, and it will not affect anything.
Well, that's only going to work for
you just use a trial work period month. Yeah.
Mm-hmm.
Okay.
But with the SGA number, it's higher. Go ahead, Meghann. I'm sorry.
Yep.
Oh, no, it's fine. I was just going to say that, with that SSDI, you can earn as much as you want during that trial work period without it affecting your check. What MaryJane was saying is that if you earn over the 970, then that's when they count the 9 month, one of the months of the trial work period, if that makes sense.
Gotcha. Yeah. It sounds like a pretty soft landing. It's really incentivizing the individuals to go after that employment that they are interested in and try to relieve some of these fears and these worries that come along with it. Because I've heard from community members, we're interested in gaining employment, but I have great benefits. I don't want anything to interact with that. And it sounds like the government, federal government, state government, has tried to set it up where it's very easy to, if something happens, you'll have those benefits in place for you. We're talking about 9 months. We're talking about 5 years. Kind of soft landing, easing into that process there. I would like to take a question from an audience member. Corey Merchant asked, can either speaker speak about hopeful federal legislation, the Supplemental Security Restoration Act? I am unfamiliar with that. Have you heard of that before?
I'm not familiar with what the question. I don't know. I'm not sure.
I do know I've heard that they're trying to increase the resource limit for SSI right now. That may be part of it because they set the resource limit at $2,000 back in the 70s, I think, and it has extended, and it's very difficult to save for anything if you can't have more than $2,000 in assets. So that may be part of it, but other than that, I don't know anything about it.
Speak a little bit more about that $2,000.
Well, with SSI, there are two things you have to really be careful with. One of them is making sure that you report your wages each month, because that is going to determine how much you're going to get in the way of SSI. With the resource limit, your combined bank accounts or anything that you have that has, now we're not talking about a car or your house that you're living in, but if you have anything that has a cash value like an insurance policy, that is considered as part of the resources. If you exceed $2,000 by the end of the month, that can cause not termination, but it can cause suspension of your SSI, which could also cause you to temporarily lose your Medicaid, and for people who are on the Medicaid waiver as well. So that's why we tell people to please be careful. But there are ways that you can save beyond that $2,000, and one of them is an ABLE account. We have ABLE here in Alabama, and you can save up to about $100,000 without having any impact on the resource limit for SSI.
Mm-hmm. Now, is that something that you'll recommend during this process when speaking with individuals? So let's say they're coming to you saying, I want to work. I think I'm going to start making more money than $2,000 a month. Is that part of that conversation?
It is for anybody who became disabled before the age of 26. You cannot have an ABLE account, if you became disabled after that age.
Gotcha. I am going to acknowledge chat once again. Mrs. Merchant says the SSI Restoration Act would raise SSI's sub-poverty level monthly benefits, currently at $794 per month, to 100% of the federal poverty level, a 31% increase, and index them to inflation. Update and index the assets individuals or couples may have up to $10,000 and $20,000 respectively. So this is all new information to me, Mrs. Merchant. I appreciate you sharing this in the chat. Any comment on that?
I just looked too, just to see, and it's basically a bill to update eligibility for SSI, and it does have, where they would be inflation adjustment and updates in some of the earned and general income exclusions also. So yeah, but that's basically what I can tell.
So it sounds like it may be on the docket here in the next year or two or in the future. Mrs. Dasher, you mentioned that $2,000 limit. When was that implemented? You said the year, I forget it.
Sometime in the 1970s or early 1980s. Meghann, do you recall?
I don't know. I'm not sure.
But if you were to take that to today's value, that's got to be somewhere closer to like $6,000, $7,000 in
you would
buying
think so.
power.
If not more, right? I mean, you couldn't even get, if you needed it, you couldn't even buy a guide dog with $2,000.
That's a very good point. And these are things that individuals that receive these services need in order to get to work. So it's kind of like, let's raise that $2,000 limit so that we can purchase these things so that I can go back to work and keep being a productive member of society and doing the things that I want to do. Now, we've heard some limits, the $2,000 limit, but is there any ultimate limit that I can make where everything goes away?
Well, I think that is actually up to the individual. I'm sorry, MaryJane, you go ahead. I was just going to say that's really up to the individual.
Correct. They can make any amount they want, but with someone like SSI who want to make sure that they maintain their Medicaid, the threshold this year is $34,521. Now, these numbers go up every year. And when the person earlier was talking about SSI payment being $794, this year it's actually $841, and next year it's going up to $914. I think we have a little bit over an 8% increase starting in January.
Okay. And I guess it is in the end, let's say you go back to work and you start making six figures. Well, that, maybe you're not as worried about some of those other benefits because you're able to be on your own at that point. Is that kind of the goal of long term?
Well, yes, certainly. I think that the WIPA project is definitely to encourage or show, so that to provide the counseling so the individual can make an informed decision. But we certainly want to reduce, I can't even talk right now.
Reliance on benefits. We want to reduce their reliance on benefits. Correct. Yes.
Right.
Yeah. And that makes sense because, it doesn't, sometimes it feels better when you're able to go and be a part of a team that produces something that others enjoy using. And it goes a lot more far further um, than receiving just benefits, but being going to work, being interested in what you're doing every day, getting out of the house, or maybe you work from home. Those types of things is an important part there. Now, how many individuals, let's say, has WIPA interacted with in the last year? How many individuals do you guys serve yearly?
Well, I know over the last 2 years, over the last year, we've hit right at about 400 people with
Okay.
WIPA. But we also have another program through DMH where we, concentrate primarily on people who receive Medicaid waiver services. And there we've had about 300 in the last 2 years. So over a 2 year period, we probably touched right at about 700 folks.
And that's 700 folks. What would you say is kind of the success rate there that come receive services through WIPA and then are able to gain employment and navigate that correctly?
That's not something I've really measured, but I mean, we do have people who become less reliant on their benefits. So I would say it's fairly successful.
Yeah.
Mhm.
And so, every 2 years, about 700 people are actively working to get gainful employment, receive kind of less benefits, and be a part of the workforce there. That's quite a bit of people.
Yeah,
Mm-hmm.
I think that the majority of the people that we work with and we provide these services for, they do end up going to work at some level. So I definitely think it's very successful.
I'm going to acknowledge chat again. Corey Merchant has put a few links in the chat just about legislation and advocacy, which is always very important. So contact your representatives and make sure, I think that's something that this community, the disability community, can do, does well, but can do a little bit better, is having relationships with our representatives and letting them know what the day in the life looks like and what we need as individuals and as a community. I feel like a lot of times most people don't understand that, and there's a lack of communication there. So it is very important to do that legislation. Okay, so I'm going to jump back in. Let's just do some examples. So let's say I'm receiving benefits, healthcare benefits, Medicaid. I am looking to go to work at a corporation, an organization that provides healthcare. How would I navigate that?
Well,
You
you
can
can
have
definitely
private
that.
insurance, Medicaid and Medicare. You can have all three of them if that applies to you. You just need to make sure that you inform your medical provider what insurance you do have, because it depending on what kind of service you're getting, some will pay first. Now, Medicaid is always going to be the payer of last resort.
Okay, so it would the first one would go through the organization's healthcare, and then if things were unpaid through that coverage, then it would make its way to Medicare, Medicaid, and other benefits that you receive before gaining employment.
Mhm. Yes, you can
Okay,
definitely
good.
have used all. You just have to make sure that you let the provider know, like MaryJane said, so that they can do the proper billing.
Okay. Now this is I just imagine talking about this is like a mind map where there's like 50 different things and calculations going on. Is there a web page or a resource that I could be able to go later today and see, put in some information that I have, what I'm currently receiving, what I'm expected to make at a job, and have that calculation come out and say, this is what I need to do?
We do not
Not
have
really.
a place for that at all because a lot of times, too, you have to understand that some of the individuals don't know what type of benefit they're receiving. So if they think they're getting SSDI, but they're really getting SSI, that would kind of, you know, it might the information might not be correct. So that's another reason that we verify the benefits before we give any of that information. But what we do as benefits counselors is that once we do verify the benefits, we give you the work incentive information, but we also provide the individuals with written benefit summary and analysis that explains all of the work incentives that will be available and how the benefits are going to be affected based on the work they're currently doing, or maybe if they're not working, then on their work goal or
Hmm.
earnings goal.
Yes, ma'am. Now, I know that there are organizations in Alabama that will help through that process of finding employers, getting employment. Do you guys do any of that, or is this more of kind of financial planning almost? We're sitting down, we're having all the documentation, and we're going to give you this packet, this plan, but do you guys then go and help gain employment?
Well, if they need a job, we refer them to sources that can assist them, like the Alabama Department of Rehab Services or the local career center.
Mm-hmm.
So, but we don't personally find jobs. We just let them understand exactly what could happen to their benefits.
It sounds like a financial planner or kind of financial planning to me. So if I have questions about retirement or anything like that, I will contact somebody. They can walk me through what I'm currently receiving, what I need to, uh, plan for in the future, and then at the end of that, I have a game plan. And it sounds like a big benefit of working with WIPA is there are a lot of things like with a financial planner that I don't think about or I don't know. And as you've mentioned before, you may not know if you're on SSI or SSDI, and you may be navigating it as you're just not having all of the information. And part of the benefit of working with WIPA is you guys will help me consolidate all of that information and give me a packet at the end of the day that I can take home and start planning, and then I can work with other organizations such as ADRS or local organizations to start my gainful employment with that organization. So this is kind of, I feel like when people talk about employment, this is one of the biggest fears that comes up. I want to work. I don't want to lose my benefits. And this seems like it would be an early step in that process.
Sometimes it is an early step and sometimes it's an after step because we might get somebody that's already working and then we kind of have to backpedal. But I mean, it's certainly there for any time during the process.
Mm-hmm.
Have you had that before where somebody goes to work and then they start losing some of the benefits they didn't know, and then they're now coming into your office?
Oh yes, we
Well,
get people that
yeah, and people will sometimes quit their jobs before contacting us, and that's a mistake because if we were able to explain to them exactly what's going on and how those work incentives will help them, then we can keep them employed and not have the fear of just losing everything.
Hmm. That brings me to my next question. What are some of the do's and the don'ts um, when looking for work in SSI?
Well, that was something we covered a little earlier. The resource limit, watching that, making sure that those wages are reported monthly, because you can very quickly get into an overpayment issue or even an underpayment issue, and neither one of them is good.
Now, how do I report the wages?
Well, there are different methods you can use. So they can be mailed into Social Security. They can be faxed to Social Security. There's a phone. There's a number you can call and report over the phone. There's also apps on my Social Security accounts. I think there's also an app you can put on your phone. But and we also will help if someone, we constantly have people who just don't feel comfortable with technology, and they will send us their wages, and we report them for them.
Does the employer have to report wages as well monthly
No, the
to
report
SSI?
the employer does not do that for them. We do have a lot of people who think that their employers are reporting, but that's not something that is done by the employer.
Okay. And another don't you mentioned is there was an instance where somebody was working, some of the benefits got cut, and then they quit their job. Why don't you do
Correct.
that?
Well, because if you end up with an overpayment, this is something that always can be worked out with Social Security. There's sometimes when people do things and they think they've properly reported, and they can actually file a waiver with Social Security and get either all or some of it waived. But Social Security will work with someone. They're not going to take every dime that you've been overpaid immediately. They will work with you so you can pay it back over time. But
Hmm.
you're always, always going to live better working than just being on benefits.
Hmm. What are some common fears that you see from individuals kind of in that first meeting when you meet with them?
Well, definitely. there a lot of individuals are afraid to work because they don't want to lose their Medicare or their Medicaid. And through work incentives that are available, in most cases, every individual would be able to keep this coverage either indefinitely, or if you're depending on what your earnings are. But in most cases, you're able to keep both.
Okay.
Some other things are with the SSI individuals that are receiving that. Some of the fears that I've heard is, I already can't live off of the $841 that I'm getting each month. I can't afford for that payment to be reduced when I go to work. But we're able to actually provide calculation sheets to show them that even though the SSI payment is going down, the actual income that the individual receives is going up. So they actually have more to live on than they did before.
Mm-hmm. That's a big thing, I think. Let's say, that gross is $1,000. Well, maybe your SSI went down by $200, but in the end, you still got 300, 400 more dollars at the end of the month for, living or whatever you want to do there. I would say one of the fears that I personally have, I have a family member who receives SSI, and her father, my grandfather, was her guardian a number of years back. When he passed, I became her guardian. And there were months there when SSI was kind of dragging their feet. I had to go to their office 3 times over like 6 months until she got her SSI reinstated. Now, when it did get reinstated, all of that money was there for her. They did deposit it into her account. But I can understand for somebody that has that and needs that every month, that would be a big fear for me. And any changes there, there's just kind of a lag, I think, in the system, in the paperwork.
We usually do tell our consumers that if you get something from Social Security and you don't understand what's going on, or it scares you in some way, to please let us contact us, because we do have direct contact with Social Security, and there are often times that we can, you know, uh, intervene on their behalf to see what can be done to resolve whatever the issue is.
And just to
So you
add to
guys,
that as well, is that with the SSI, when you go to work, and if you're going to work and you're still going to be eligible for, a portion of that SSI payment, it is going to take it 2 months to see the decrease. So if you stop working, it's going to take it 2 months to get back up to that original amount.
okay. So just a forewarning that it does take about 2 months for all the paperwork to get settled and for there to be any difference up or down in the bank account. And I think that's something that individuals should plan for, whether that's saving a little bit more money, knowing if you're going to stop working,
Mm-hmm.
that there might be a little bit of reduction there until the SSI catches back up. And it
Mm-hmm.
sounds like you guys have the ear of SSI here. So sometimes if I'm having trouble getting a hold of SSI, or I've got to go wait for a few hours at my local branch here, you guys can help me connect with SSI and have a little bit closer relationship there than somebody else might have, which is a really nice resource. So you're meeting with individuals that are coming to you saying, "Hey, I want to go to work, or I'm currently working. I would just want to make sure the benefits, all the SSI, SSDI is working out." What types of jobs are you noticing that individuals that are receiving services are going after or are currently in? And I want to highlight this because there may be some audience members that are watching this that think, I can't work. I don't want to go to work. That seems scary to me. And I want this to be kind of other people are doing it too, and some examples there. So, what are some examples of types of employment that you see people gaining?
Yeah, everything. People work in the food industry, all the way up to, we have people who work for NASA working on computers. I mean, it just really depends on what that person wants to do.
Hmm. So, you're seeing a wide range there. I'd like to work for
Yes.
NASA. Like, what?
Yeah.
That'd be cool. And then another one of the fears that we've kind of talked about before, but just to clarify, what happens if I go work for NASA and then I get laid off? What happens to all those benefits that I used to get?
Well, it depends on when it occurs. We talked about the extended period of eligibility if someone's receiving SSDI. If it happens after they've made that SGA decision and you're still in that extended period of eligibility, you just call Social Security. It should start, fairly quickly. And then, the only time the person really has to reapply is if they've gone through all the work incentives that are provided by Social Security, the extended period of eligibility and expedited reinstatement. Is there anything I'm missing there, Meghann?
No, I think that's everything. And if you're SSI, like we just said, it would take 2 months, to see that increase to come back.
Mhm.
And if your payment was at zero, it can take some time to get that payment restarted.
Yeah, so you need to plan for that and save for that. Now, let's say, okay, this is great service. I never knew about WIPA. How do I go about contacting you and setting up an appointment? Because this isn't something where I have to be in Birmingham or Huntsville. This is statewide, correct?
It is
We cover the
statewide.
southern part.
Yeah. So go ahead, Mary
Meghann, go
Jane.
ahead.
I'm sorry. Oh,
All
you go
right,
ahead.
it is statewide. We cover the southern part of the state, and disability rights and resources, they cover the northern part of the state. But the way that you can get in contact to make sure you get in contact with the correct WIPA program is that we do have a website. On our website at DMH. We have a link, and it actually shows what counties we cover and what counties disability rights and resources cover, and the contact information for both. You can also go through the Ticket to Work helpline with Social Security, and they can do the referral for you.
I'm writing this down because we're going to go ahead and put those links in the chat. All right, Ticket to Work helpline. And it's
Meghann, do
not
you have
just
a
you two. So
number?
I do have the number. Do you want the phone number?
please.
Okay, it's 1-866-968-7842.
And so once, if I'm in the south of Alabama, it's not just you two. So that's caseload. You have others that are on your team, correct?
We do.
Right. There are a total of 6 of us with Department of Mental Health, and there are 3 with Disability Rights and Resources.
Okay, so 9 consultant coordinators throughout the state then. Now, when you're meeting
Correct.
with individuals, are these one-on-one meetings? Is it more with family that you notice? And then is it virtual or is it in person?
It depends on what is best for the consumer. It can either be on the phone, Zoom, in person, just whatever is required.
Okay. I feel like everyone's really comfortable with Zoom. It's become, I don't know if it's going to be in the dictionary here shortly, if it's not already, but a lot of people will opt for that. I prefer in persons if possible. I'd like to meet
Mhm.
somebody and shake their hand, but I understand if people want to go virtual there. So this, Mrs. Miller, you mentioned you believe it started about 2008 when you started there. And how long do you foresee this service going there? Is the funding there for long term, or is this something that we have to keep renewing and that we need to keep advocating for?
Well, we do. It is a grant that is a 5-year grant. So at the end of the 5 years, then Social Security, makes the decision on whether or not they're going to, open up another cycle for the grant to be renewed. They might change some of the how we actually, provide counseling. It just depends on, I guess, the legislation. But
Okay.
the grant cycles are 5 years, and we're
Okay.
currently in the second year.
So we're guaranteed 3 more years. And so the kind of behind that question is what can we do as a community to try and make sure that the legislators and the grantors are know what you guys are doing and the success you guys have? Is there anything that we can do, Alabama Care, in the community?
I'll let you answer that, Mary Jane.
Oh boy. I guess just reach out to Social Security and our congressman, and just let them know that if we're working with you, if it's beneficial, and that you really need to have that continue, help, because
Mm-hmm.
when we do start working with somebody until they reach retirement age, as long as they have benefits, we continue to work with them. So I mean, it's not that we one and done. We don't write a report and they never hear from us again. So if it's something that you find to be beneficial, then just reach out to Social Security or the congressman and let them know.
Yeah. Kind
And
of
also
document your
that,
success.
I'm sorry, I was just going to throw in the when I talked about, the ticket to work legislation, um, the first, I guess, grants that they started was called BPAO, or the Benefits Planning Assistance and Outreach Program. And then that was modified and renamed WIPA in 2006.
Okay, so it's been going on for quite some time. Just got a new name and face there in 2006. We've had it in Alabama about 2008. It's a 5-year grant, and we want to keep this thing going. So if you're going through this program, or if you're thinking about, contacting WIPA, we have the number here in the chat. You can do so. We'll put the links. But start to document your success. So let's say you're not working currently, and then you do gain employment and you're a success story. You need to take that story and reach out to our legislators to keep this program going and allow others to take benefit of it as well. Now, is there any cost to the consumer? I'm thinking about calling up. Was it $20 an hour? I got to put some money aside. What am I looking at?
There's no cost. It's all free. And we work with people from the age of 14 to retirement.
14 to retirement.
Mm-hmm.
So for me, I'm thinking, I would want to do this as a parent. I would want to get my child started if they were 14 and receive services. I would want them to be familiar with the financials behind how kind of navigating disability works financially. And this would be one of the processes that I would start out with so that I better understood, and you guys could help me walk through, take my hand and walk me through that process.
Correct.
Is there a success story that really sticks out for either one of you? Like working with an individual and it's become a huge, difference maker in their life. Is there any success story that really pops out to you?
Meghann, you have one? I think I do, but
Yeah, you can go ahead. I'll get one too, but you can go first.
I have someone who was working for a small city, and because of his disability, he was only able to work part-time, 10 hours. But the city he worked for, they really needed his services, so they agreed to hire him for those 10 hours, but pay him as though he was working 40 hours. So he actually ended up with a yearly income of about $65,000. Well, because of expenses that he had incurred well before he became disabled, even the $60,000, if he lost his cash benefit, he was not going to be able to continue to work. Well, since he was actually working only a quarter of the amount of time that he was being paid for, we were able to apply for, with Social Security, something called subsidy. And it's where they reduce the amount of the countable earnings by a percentage. So since he was only doing that, the work of someone maybe 25% and still getting that pay, we were able to get him that subsidy. So instead of looking at the full $5,000 a month he was getting, they were only looking at $1,250. So he remained below SGA and he was able to keep his cash benefits. And that will continue until he gets those expenses more under control. And at that point in time, we hope he'll be able just to go off benefits.
Yeah, that's a really cool story. Mrs. Miller, is there one that sticks out for you?
Yeah, I mean, we have, there's tons of, individuals that we work with that actually do go to work and are successful. I think, probably, like MaryJane mentioned, somebody working with NASA. I've had individuals that, they were concerned about going to work in their Medicare, but they're a nurse practitioner and about to get their license and go to work, which is awesome money. And once they get on there, they're going to be able to, come off of their benefits, and they feel pretty good about that because of the work incentives that are available. It doesn't just happen, overnight. But and not even just talking about individuals, that that work and come off of their benefits. But a lot of the things that we do that we can help people that I think makes it a success story is, for instance, I worked with a single mom who had, 3 children and, 3 dependent children in the household. And obviously she was struggling there. Um, that and they weren't enrolled in a Medicare savings program that helps pay for her Part B Medicare premiums. We were able to help get that started for the individual, which really helped because that saves $170 a month. To help pay that. Also, the individual, once they received all of the work incentive information, she felt comfortable enough to go to work. So now she's got more money to provide for her children.
Hmm. It's kind of like you don't know what you don't know.
Mm-hmm.
To
So
be
yes, so even though we're doing benefits counseling and trying to tell you how your eligibility is going to be affected when you go to work. But if we see that you're not receiving a benefit that you could possibly be eligible for, that's also one of the things that we do is to tell you about those programs and to help you get enrolled in them if it's something that's going to help you.
Yeah, it's a holistic approach to navigating the system. Mrs. Dasher, I apologize. I was cutting you off there.
No, you didn't. But I was just going to say that a lot of times we find out that people, maybe they do receive food stamps, but it's not sufficient to help pay for the food that they need for their families. So we will also connect them with resources in their community that can help them. Either if they're struggling one month to pay their utilities, or they need assistance with food or clothing, we can help connect them to those resources that help with that as well.
Gotcha. As we come to a close here, is there anything that we haven't covered, or is there anything that you would like to say to somebody, an individual or a family, about WIPA?
Well, I would just say that basically, I think that we've kind of touched on everything today. I would just like to reiterate that SSI and SSDI programs treat income differently. And I think we've said that quite a few times today, but that is definitely a point to be made. But in most cases, you can work and keep some or all of your cash benefits. Medicaid and Medicare can be retained almost in every case, and the duration is determined by additional information that we would look into, on an individualized basis. It is possible to work and come out financially ahead, even if the benefits are reduced. And it is possible to restart benefits if they are lost due to work, as long as you still meet the definition of disability through Social Security. And then, we are providing this service to anyone that is receiving disability benefits between the ages of 14 and retirement age. And it is a free service for anybody that is wanting to know how work will be affected, or how work will affect their benefits.
Hmm. Mrs. Dasher, is there anything you'd like to close with?
Well, there is one thing. We often do have people who contact us and say, hey, can you help me apply for benefits? That is one thing we are not allowed to do because it's totally contrary to what we try to do. So just to keep that in mind, we cannot help you apply for benefits. But if you're on them, that's when we can work with you.
Yeah. And I'd say to most people, it can be a little intimidating. There's a lot of kind of jargon that we talked about today that many people don't know those words or how that works. Pick up the phone. That's all you got to do is just get in the system, pick up the phone. Mrs. Dasher, you might be with Mrs. Miller, or you might be with DRR, but get in the system, start working at it. Don't be afraid of employment. In the end, you're going to come out ahead. You're going to feel better about coming out ahead, and it's going to make a difference in your life. So don't hold back. Pick up the phone. Mrs. Dasher and Mrs. Miller, I want to say thank you for being with us here this morning and everything that you guys are doing through WIPA. And yeah, thanks once again. I appreciate your time.
Thank you.
At this point, we'll go ahead and end the broadcast, and we'll give our our cameras a wave and say, see you guys next time. Okay, bye.